Hello and welcome, students of NKT. This is another episode of Test, Don't Guess. I am excited to have on today Dr. Brock from Toronto. He is a doctor of chiropractic and he is also a lead instructor of NKT. Brock, thank you so much for being here today.
Thanks for having me, Brandon.
You're welcome. Brock, I just want to hear about your first beginnings and learning of NKT. When did you first hear about it? What did you think of it when you first saw it? What was that experience like for you?
And NKT first came into my world. It was via Amanda Moore, who Dr. Amanda Moore is a fellow chiropractor here in Toronto, and she teaches the level 3s with me in Toronto. And she had just gotten back from a course in New Jersey, I believe, and she was following Perry Nicholson from Stop Chasing Pain. This was about 5 years ago. I really looked up to Amanda at the time. I thought she was a phenomenal chiropractor. She was who, like, I essentially idolized in a way. And when she came back from this course, she was more buzzed, more jazzed than I had ever seen her from any continuing education course before. And she's like, "Yeah, I just learned this course. Like, it changes everything." And then I was like, "Oh, how does it change everything?" You're like, show me. So she laid me down and she found a weak glute and just like touched this and then it was strong. And I was like, "Whoa, what's happening?" She's like, you got to take it. And then from that point on, it was like priority one was make it to these NKT courses. So that was how I was initially introduced, probably about 5 years ago, 2012.
Okay. Yeah. Wow. Okay. So it was kind of through a friend and then through Perry and you took it after she had talked to you. And then what was that experience like taking that first level 1? Did that kind of piece a lot of things together or did that almost pull a lot of things apart and add confusion, or what was your experience in that first course?
Well, I guess the introduction to muscle testing, I was quite critical. I was very skeptical. Muscle testing had been introduced to me in a very skeptical way during chiropractic college. It wasn't very well accepted at Canadian Memorial Chiropractic College. It was more taught as something that existed, something that was out there, even though there are many manual muscle testing techniques. So I went in very skeptically, and David Weinstock can definitely attest to that because I kept telling him like, "Oh, you're pushing too hard. You're pushing harder that time." And then he would just look at me. He's like, "Well, yeah, I'm trying to sell this to you."
Yeah.
And I was like, "Oh man, this guy's calling spades a spade." So once you get to know David, you realize he's in it for the right reasons. He's a very legit guy. He's there to show you something cool, and it's up to you whether you want to take it and run with it, or if you want to continue and pretend it never happened type thing. So very skeptical. Once I felt it in my own body, once I felt it on other people's bodies, that's when I realized that muscle testing, there's a lot of information there. There's a lot of value to it. And at that point, being a pretty young chiropractor, I knew I just couldn't turn my head the other way. I knew that I had to, master it in a way, or at least put everything I had into it, learning it and making sure, I use it as effectively as possible. And if I can bring it back to one moment, it was when David therapy localized my cervical spine for my left glute. Wow. And he said, he's like, "You're one of those chiropractors, eh?" And I was like, "Yeah, I'm one of those guys." And then he just started putting, a bit of a different therapy localization, a little bit of lateral, a little bit like a rotary. And the rotary therapy localization really locked my glute in, and the lateral one, wasn't quite as good. And he's like, "Make sure you use a rotary adjustment for that and not a lateral break." And
wow.
So he took something, he's not a chiropractor, but he really took and he applied it to my world, and he really made it the missing link in my practice. So after that, any adjustment that I did, any muscle I released, I wanted to understand exactly why I was doing it. So that's when I realized it was the missing link. And then I had lunch with David that same day. Everybody had kind of dispersed out and left for lunch break. And David was the only one who hung around because he brought his lunch. I think I skipped lunch that day. Hunger was not on my radar. Yeah. And I told him, I'm like, "Man, this is incredible. This is like the missing link. Like, do you realize it?" And he just kind of had this like almost shit-eating grin. He's like, "Yeah, it's pretty cool, right?" I was like, "Why are you just like leaving now? Why are you just, showing the world now?" And, he just really seemed like, he had been content for the last 10, 15 years, teaching it locally. And it wasn't until, Perry kind of pulled him out and said, "You got to come up here. You got to spread the love." So that's when I realized he really was in it for the right intentions. He just wanted, to share his knowledge instead of, grow something and make his way the right way and, change how people do things. He was in it for the right reasons. And that really rubbed off on me the right way, because you go to a lot of continuing education courses, and it's a lot of egos, it's a lot of pushing, it's a lot of, my way's the right way, your way's the wrong way. And I didn't get any vibe from that of NKT. It was more like, this is about making you better, and take it or leave it. So that casual attitude was very appealing to me.
Yeah, David's got a lot of great humility and generosity, and just a willingness to give to people. It's really amazing.
Yeah, wonderful guy.
Yeah. So okay, 5 years ago ish, you took level 1, and then how long did you wait until you took level 2, level 3? What was your procession or proceeding of taking the rest of the course?
Well, I guess it was like October 2012. I took level 1,
Mm-hmm.
and then it was probably around November, December, and I had a few successes. I had many more failures, and there was at a point where I took a couple weeks off NKT. I took 2 weeks off, and I was like, I just need a little bit of a break. There's some frustrations that were mounting here and there. I struggled with my testing, feeling for a lock, what wasn't a lock. So I took a little bit of a break, and then when I went back to it, my hands just kind of started talking. And that's when I started feeling like everything was much clearer. I had learned the motor control, if you will. So that's when I signed up for level 2. It would have been the following April. And I think I took another 2 or 3 week break around February, because I understood what that 2-3 week break did for me when I took it in like November. And it actually really excelled me. It was like, I think it made me better than I would have been if I did use NKT for those 2-3 weeks. Strange as it sound, maybe, something like set in a little bit more. But it was after I took level 2 in April that I use it all the time with every patient. Whereas before I was kind of like picking and choosing my spots, not really knowing what I was basing it on, right?
Mm-hmm.
And then level 3 was, I think, 2 months later. It was the first level 3. I asked David, I'm like, when's the next one going to be? He's like, I don't know, take this one. I'm like, deal.
Okay, wow, pretty quick then.
Yeah, I zoomed right through it. I was hungry,
Yeah. And so you had Amanda in your area. Did you have a lot of other NKT practitioners, or was it kind of just the 2 of you?
It was just the 2 of us.
Wow.
It was just the 2 of us. And luckily at the time, I was a fairly fresh chiropractor.
Mm-hmm.
So I wasn't very busy. I understand that when people learn NKT, and if they're in a very busy practice, I can see the obstacles to, learning a new skill, especially if they don't muscle test. But luckily I was able to ask some patients, can I spend an extra 10 minutes with you? Can I spend an extra 20 minutes with you? And they're more than happy, right? Because they see that therapeutic intention is there. So I got to play with it quite a bit. So, I felt like I was kind of in the trenches in a physiotherapy in a basement clinic in a hospital where, muscle testing was just, not part of that physiotherapy clinic. But it was really good for me, because there is that wonderful community online, the NKT Scholars page. I was reading that every night before I went to bed. And that was like almost the support group I needed to keep going when I had the frustrating days. And then when you have the good days, you want to show it off, right? You want to tell everybody about it. And it jazzes you up, and it kind of keeps you going.
Yeah.
Man, if I can tell you this one story, I remember I spent 40 minutes with a patient, and it was probably like, I think it was November. So it was about a month after I took the course. And I remember being the most frustrated I had ever been after a day of work, because I had just spent so much time and I felt like I didn't really get anywhere. I wasn't really sure what I was feeling. I felt I didn't really feel any concrete patterns. I treated a few things, but I wasn't convinced I was on the right track, right? I didn't have that, somebody saying, yeah, you're on the right track. So I was kind of felt like I was running in circles. And I remember the next week, I got 2 referrals from that patient saying I was the most thorough therapist they had ever seen.
No way.
So that's when I realized it was like, part of the intention was there, just using manual muscle testing. And even if I didn't find anything, there was still value to that, because there's still that interaction, by having them test different areas, you're increasing proprioception in a way. And I almost started feeling like just muscle testing on its own had some value to it. And I didn't know if there was like the proprioceptive aspect, or it was just that comprehensive aspect that patients just weren't used to getting. Because up here in Canada, we like to take pictures, we like to take blood tests. I know you guys are kind of similar down there, but as far as like that hands-on time from the therapist, uh, that doesn't happen very often for a lot of patients. So when they see that, I think there's a lot of therapeutic value just to that. So even you are learning NKT, even as you feel like you're not succeeding in NKT, there is still a patient, a doctor-patient benefit
Yeah.
to that learning process.
Yeah, that's really great. What are some other things that maybe, you talked about how you got really frustrated and you got frustrated with testing, and that's a great story about your frustration, but still using it and showing that you were being thorough to a client. Are there any other kind of like big mistakes that you made early on, and maybe things that you kept racking your brain over but finally figured out that you could share?
Mistakes using early on, definitely testing too hard.
Mm,
I have this habit, I see it all the time teaching. When patients are having trouble feeling for that lock, they tend to push harder.
okay.
And the harder you push, as you know, sometimes it's harder to feel that lock because you can push past it quite easily. And I remember testing a neck, and I tested a scalene, and I was kind of going a little hard, admittedly passing a medium pressure, and it just kind of like grabbed on them. And they did like a quick, it was almost like a cramp in the neck.
Mm,
And that patient left worse that day.
okay.
And it's the only one that ever sticks out in my mind of, an actual failure is for me pushing too hard. And it was because I really wanted to see how much strength was there.
Mm,
So ever since that day, I go much lighter in the neck. I find the lighter testing in the neck gives me way more information. And I never let a head go when I'm testing it. I never hold a head up and push it down. I
mm,
always keep both hands on that neck. I'm always testing with two hands.
okay.
And I'm very thorough, and I share that with everybody that I teach because I think that's a very, very valuable lesson. And, big mistake that it made me a better practitioner, a better tester. That one patient who went through, an uncomfortable neck for like 3-4 days. So I think,
Okay. Yeah. And then I'm curious, how is your practice? I mean, you said that you started off as a pretty new chiropractor learning NKT, but how have some of your practice techniques and way that you do things in your office changed since starting to do NKT? I mean, over the past 5 years of now doing this, how do you look back and say, oh, wow, what I do now is actually really, really different, or there are some things that still stay the same? What are some of the big changes that NKT has just brought to your practice?
Oh man, I have no idea what the hell I did before NKT, to be
Yeah.
quite honest with you, because I was new and I was lost. I did a lot of adjustments as a chiropractor, and a lot of success adjusting as a chiropractor, because I feel it's very effective mode of therapy. But for those patients that did come in, the next week and were like, I felt great for a couple days, it's kind of crept right back. When are things going to get better for me? And I was like, man, I'm 6 digits in debt right now. I should have a better answer for you than I don't know.
Mm-hmm.
So I had a lot of I studied a lot of anatomy before NKT because I didn't know really what else. Like the orthopedic tests were helpful to a small extent. You really focused on your palpation, which I felt like I was pretty good at, but I was pretty lost. I was always just wondering like, what am I supposed to do?
Mm,
And that's when I realized, these educational institutions such as chiropractic college, massage college, physiotherapy college, et cetera, they're almost like a baseline. They teach you the black and white, but the whole fucking world is gray. So what are you supposed to do with all that?
mm-hmm.
So it's where the good stuff is all the continuing education, right?
Yeah.
So now that I'm a continuing education junkie, I love it all. I like to think of myself as a pirate. I take what works, I abandon, I make walk the plank what doesn't work, and
Mm-hmm.
that's the beauty of NKT, right? It allows you to blend all those modes of therapy. So before NKT, which was a big baseline for me for continuing education, I have no idea what I did. Like I just palpated, and if it was tight, I released it, and if
Yeah.
the joint didn't move, I adjusted it.
Mm-hmm.
and effective to an extent. There's really nothing wrong with that. Um, you get mostly successes, I think, with that. Not definitely not all the time,
Mm-hmm.
but being in Toronto, chiropractors, we're a dime a dozen.
Mm-hmm.
It's sink or swim. So I knew I had to differentiate myself. I wanted to be the best. So that's why when I came across NKT and I saw that value to it, and I saw that all my colleagues, all my profession, were kind of turning a blind eye to muscle testing because inconsistent research, how it had been presented to them. I was
Mm-hmm.
like, everybody's looking away, and like I see the value here. Like there is extreme value here. So that's why I stuck with it, and you could probably say I was obsessed in a way
Yeah.
of understanding it and using it as effectively as possible.
Mm-hmm.
And man, it totally worked because now I completely differentiated myself as a chiropractor in
Yeah.
Toronto.
Yeah.
Yeah,
Yeah, I think we all become slightly obsessed with NKT when we first learn it. there's, a,
totally.
there's a little bit of an addiction, maybe an unhealthy even addiction that occurs.
Oh yeah, because you don't sleep as much, right? And
No.
then patients come in, and you're like, or every time they leave, you're like, oh, I should have tested this, I should have tested that.
Mm-hmm.
And you're lying in bed, you're like, tomorrow, what am I going to do? I got to have a plan here.
Yeah.
What am I going to test?
Yeah.
Because you don't want to sit there looking lost, right? And well, the good thing is when you first take NKT, like you're the most lost you'll ever be after
Yeah.
that. Because as
Yeah.
long as you stick with it, you get less and less lost always.
Yeah.
And
It's true.
and I tell my students, like if I'm lost, it takes me like 5 to 10 seconds to get back on track.
Mm-hmm.
But it definitely was not always like that.
Yeah. So, run me through a little bit of what it's like in your office when a new client comes in to see you. If they've never heard anything about NKT before, how might you explain it to them, or do you just kind of start in with testing, or how would you incorporate NKT with like a new client?
Man, it varies so much depending on the client. Um, a lot of people get referred to me understanding that my approach is quite different. So a lot of them aren't interested in hearing it, and I don't really like to say too much until I understand what their issue is. I look at muscle testing as a physical assessment, so I don't necessarily like you get your permission to touch as you start testing them. Uh, as long as you're very calm and your pressure is very gentle, I find that their resistance is usually very gentle, and there's a good communication between the nervous systems in that sense. If people come in, start planking on the table, what I'll generally do is, just only meet my resistance. Make sure you're exhaling. It's very relaxed. I'm trying to get nice information from this. And then if they keep pushing into me too hard, I'll do one of these. I'll be like, okay, just meet my resistance here, and then I'll hold my hand, and then I won't move my hand. And
Mm-hmm.
then if they push into my hand, I'll look at them, I'll shrug my shoulders, and I'll say like, come on. And then after that, they kind of say, okay, okay, okay. And they kind of chill out a little bit. So I don't get that a lot, and maybe it's because my approach is a little bit more, maybe I'm more confident in my testing, and
Okay.
maybe my testing is a little bit more comfortable because when I first started, I always had people, pushing through me and whatnot.
Mm-hmm.
A lot of times I'm assessing areas that aren't relevant to their pain. So I tell them, before I assess the limb that is inefficient or that you're having symptoms with, I just like to get an idea of how other areas work on your body. I find that goes over pretty well. And once practitioners get to level 3, they know how to make a strong muscle go weak through a spindle cell compression. So sometimes I'll do that, and that helps them to understand that it is not a strength test, that
Mm-hmm.
I'm just trying to gain information from the body, and that things aren't strong, things are weak. That's a gym, that's a lifting. I'm just seeing if you have an understanding, if you have an idea of where these areas are in the body, if you have enough awareness in your joint to hold an arm in that position. And if you do, great. And if you don't, let's understand where the inefficiency is or where the disconnect is. I try and avoid the weak and strong unless I'm explaining that that's not what I'm testing. I'm just more testing efficiencies. I like to use that word in the system.
Mm-hmm.
I like to say, if everything is testing weak in the clear on a limb, I'll describe it as like a Bermuda Triangle in the body. There's
Mm-hmm.
just kind of an absence of awareness. This happens with like old traumas. repetitive strain. Our body gets, it's brilliant, but it's also kind of stupid, using the path of least resistance all the time. So we get stuck in these habits. And when we get stuck in habits, symptoms often come up because the body's saying, I'm not comfortable anymore. This isn't working out for me. But the body's stuck, and we're there as therapists to help show the body a different way, and increase awareness of different areas in the body, which kind of help get the body back on track. We're like a catalyst. Kathy Boone stole that name.
Yeah.
Well, she didn't steal that name. She's brilliant in that name, because like you could not have a better name for a clinic, because like we are essentially catalysts. It's the perfect name for a clinic, is what it is. So yeah, when patients come in, if they don't really understand, if they're very skeptical of NKT, then, or NK muscle testing in general, it's just a matter of testing a few limbs, a couple therapy localizations, and within 5-10 minutes, they usually think it's pretty cool.
Yeah. Definitely. So are there certain protocols that you kind of start off with when you're doing your testing? Like you always do these certain tests first, or you never do these other tests? What's kind of your initial thought process when you start doing the testing with people?
Man, it's an interesting question. So I do have like almost a quirk to my testing. And I'm trying to, only the other day I realized I do this all the time, and I'm trying to figure out why I do it, because I'm sure there's a reason. So whenever I test, I test the long head tricep both sides and erectors on both sides. Okay. So I just walk around the table and I have them push every limb into the table. Huh. And I think what I'm doing is I'm getting a little sense of how heavy and how what the difference is between them pushing with each limb. And I think if they push really hard with the right side of the body and not the left side of the body, there's something to that. Maybe that's me introducing myself to their nervous system, without focusing all on one area, going right to the area of pain. It's kind of like acknowledging each area of the body. Why I'm testing extension and not flexion, I don't have a reason for that. But that's generally how I start. And then it also gives me an idea if, left side is weak in the clear, right side strong in the clear. Is everything weak in the clear and extension? Is everything strong? And that way, when I do test each area a little bit more specifically and comprehensively, I can always go back to that. So maybe that's just like my introduction between my nervous system and their nervous system, if you will.
Yeah. No, that's really interesting. I remember a second ago you were saying, talking about how, when you first did NKT, there's a lot of getting lost, and now you've gotten lost in your NKT less. Can you explain some of those times of getting lost, and maybe what you did to kind of clear up confusion? If you got into a point where you're doing a bunch of testing and you said to yourself, oh, wait a minute, I don't know what all this means, or somehow I've confused myself. How do you kind of clear that confusion and maybe reset and sort of start over?
Yeah, so there's a few different approaches I'll take. So the first thing I learned was I have to be very comprehensive in my history, and I have to understand all their old traumas, and I have to understand all their aggravating factors, everything that relieves their symptoms, because I believe that the patient often has the answer to the question you're looking for. You just have to ask them the right question to tease out that information from them, right? So if you're lost, it's because you haven't asked that question to guide you in that right direction. So I think early on, I was more kind of gung-ho. I just wanted to test away, and I wasn't always going in there with a clear intention of what exactly I thought was going on. So the history, the old traumas, they really do guide you as to, to create those ideas as to what you think are going on. And if you're lost, you should be asking more questions, because that's where the answers lie. As far as, knowing if you are lost, you feel like you've asked a lot of questions, I guess the next thing would be to know your anatomy, to know your antagonists in all three planes of motion to each joint. That's kind of, hopefully most people come into the NKT course with that knowledge. If you don't know your anatomy, NKT is really, really hard, but it's also a great way to learn your anatomy, right?
Yeah.
And sometimes if I do get frustrated with my own testing, And I'm getting a little confused. I'm like, is that strong? Is that weak? Because, you know, the more you test a strong muscle, usually the stronger it gets. And the more you test a weak muscle, usually the weaker it gets. So if I'm testing and things are inconsistent, then I'll sometimes say, hey, you know what, I'm going to be right back. And I'll leave the room, and then I'll just take a couple breaths. And, you know, I'll kind of reset myself. I'll say, you know, they're them, I'm me, you know, just kind of break maybe a connection that has, you know, merged our two nervous systems, as you know, as ideal or strange as that sounds. Maybe I'll have a sip of water, and I'll just kind of reset within myself. And I'll just do that through a couple breaths, you know, a bit of knowledge. Maybe I'll break, you know, my thought process, because maybe I'm too into it, and I just need to break that. And like, oh, what am I going to do after this today? Blah, blah, blah. Okay. And now I'm back into it. And I feel like that, you know, 5 seconds tops, that small break, I come in, I'm a little bit clearer, I'm cleaner, and my muscle testing is improved from that. So that's one thing I would recommend if people feel like, you know, the more you test, and the more, like if you're getting stressed out because, you know, you're not feeling, you're like, oh, is that a lock? Is it not a lock? Like if you feel yourself get revved up and, you know, your blood pressure starts to go up from that, just step away for 5 seconds. Maybe it's to go wash your hands. Maybe it's to go grab a file. Maybe it's to go to the file and just to, you know, pretend to write something down. And while you're writing it down, you're just taking a breath in, right? Just to kind of create a little bit of a separation from that situation to clear your mind. And then when you go back into the situation, I think things might be a little cleaner, a little clearer.
Yeah. Yeah. The old pretend writing in your file trick. That's a good one.
Yeah, right. As long as they're not watching you write in your file, and then you're like, then your heart rate really goes up.
Yeah. It's interesting. That's the second time you've mentioned kind of taking a break. Like you said that when you first learned NKT, you took a couple breaks, and then you came back to NKT and you felt like you could do it better. And now in office, when you get confused, you take a break, and then you come back and you feel like you can do it better. So I'm seeing a theme with the breaks here, and that's really interesting to almost stop and pull away. Yeah.
That's where the knowledge sets in, right? I mean, when you're thinking of other things, that's when you know, those neurons are making the connections up there. And then when you go back to it, it's like, yeah, you learn. But if you just do something and you don't ever give yourself a break, there's a fatigue that sets in. And maybe it's a psychological, maybe it's like maybe it's an emotional fatigue. Or maybe it's a physical fatigue, but there is a fatigue if you don't break that up. And you know, I've learned that with work too, because I'm a little bit of a workaholic. I love my work, which is why I do it as much as I do. But when I really force myself to, you know, take a break from work, I went back to it, and I was like, I'm clearer. I'm fresher.
Yeah.
I'm even better at my work now than I was before, because I took that vacation. You know, as much as people say taking a break makes you better, like you need that vacation, I always thought, I'm like, oh, I love my job, I don't need a vacation. But damn it, they were right. So yeah, breaks are important, and not just, you know, major breaks, but mini breaks, and mini breaks within within the session. I think they are important.
Yeah, that's great. So you were talking about how you take a lot of history with people, and that kind of helps to clear confusion, and that's a really common thing a lot of people are saying. But what about what you might do with somebody before they even come into a session? Would you have them give you a lot of information before they come in? Would you have kind of like prerequisite things that they should do or read or learn that would kind of prepare them for your session? Or do they just come in, you know, blank page, you don't know anything about them, they don't know anything about you? And I'm talking about in terms of a first-time client, and you would work with them in that regard. What's your sort of pre-session rundown with people?
I want a blank page.
Okay.
I don't want them coming in really knowing what I'm doing, because I feel like that can create a bias or a cheat. Because I don't want them trying to alter the test. And what I do want is I want a list of every injury they've ever had in chronological order.
Okay.
And if this is all I have, you know, if it's all I have, I'm not meeting the minimal requirements of my college, so I'm not going to say that's all I need. But that's by far the most important. Like going into, at least from an NKT perspective, I want to know their job, what they're doing on a daily basis, depending on what their job, what position they're in, what movements they are, if they have a decent ergonomic setup, right? Because if people have a shit ergonomic setup, have fun helping them. If they're going back and, they're looking at a screen here, you're never going to clear up that SCM to scaling.
Right.
Yeah, I feel like, I know it's redundant, but it needs to be. And that's the history of injuries. Everything from, on my intake form, it says in chronological order, list them. And then I ask about concussions. And then I asked about MVAs. And then I ask about surgeries. And then I ask about sprained ankles. So it's pretty hard to neglect old injuries when you read my intake form. But it still happens all the time. They always tell you about injury,
Mm-hmm.
7, 8 sessions in, and it's usually when you find it, right? You start testing and you're like, have you ever heard this? Oh yeah, broke my elbow when I fell out of a tree when I was 8. It's like, oh, all right, now we're getting somewhere.
Yeah.
So as far as like a pre-reading, I don't do that. I don't have I don't tell them to maybe go to the NKT page, look up NKT. If they want to, that's great, that's fine. A lot of people like to go in a little bit of informed, and a lot of people, if they've found me that way, something about NKT they think will help them out. So that's great. They can go nuts, but otherwise, I just want a blank page in my office, something moldable, a blank canvas, and then we'll paint accordingly.
Yeah. Okay. And then before you start your NKT, what are some assessments you might do? Do you have kind of like a standard assessment protocol that you run people through? I mean, David's got a lot of really great assessments, range of motion or different things that he'll have people do to kind of guide his NKT. What are some things that you might do beforehand that, like, oh, now that I know all these things, I know I can go directly to this? What helps you with your NKT testing before you do it?
I would say gait.
Okay.
Gait is the most important physical assessment I have in my office. Everybody walks. I use it as an outcome measure. I use it as a guided tool. I like to see what they're moving from, what they're not moving from, how much time they spend on each foot, where those ground reaction forces, where they go, where they don't go. That's a big one. That's by far the most important. The more gait courses I take, a big one is anatomy and motion. I got to tip my hat to anatomy and motion because they really got me onto that. Now I'm to the point when I look at a gait, I got a pretty good idea of what I'm going to find weak in the clear. Not necessarily facilitate or inhibit it, but at least weaken the clear. So it took me a while and a lot of trial and error to find that out. But I feel like that gives me the most information. And then based on that, definitely an active range of motion of whatever joint is affected, probably bilateral and any joint related. And as a chiropractor, I got to do the passive. I like to know how the joints move. I like to know how the joints move on both sides of the body. And quite often, I'll do a quick passive range of motion in each joint on almost everything in the body. Because, when you do that to everybody all the time, it really only takes you a minute or two just to go through, the entire body and just to get a feeling of how the tissues move. Not only get a feeling how the tissues move, but how comfortable they are with you touching each limbs. Because you might start, moving the ankle, move a knee, and then you go to the other side of the body, move the ankle, and then you go to the knee, and then you kind of feel this subtle resistance. And it's like, well, why are you not comfortable with me on this knee? This has nothing to do. It's like, oh, I hurt my knee before.
Yeah.
Okay, we're working with the left shoulder, but if you got a left knee issue, that's going to have an effect. We can count the ways that a left knee would affect a left shoulder. So it gives me a bit of an idea about how comfortable they are with me touching even or holding each limb. A few orthopedic tests when indicated for specific limbs, but between gait, active, passive range of motion, and your muscle tests, that's all the information I need from there.
Yeah, that's great. So when you actually start doing your NKT testing, how much time do you spend doing the testing? Well, first of all, actually tell me, how long are your sessions with people as a chiropractor? What's your typical session length?
And so I work out at 2 clinics.
Okay.
One is your more classical wellness clinic. It's called Upper Beach Health and Wellness, and it's in the beaches here in Toronto. So I work with there's other chiropractors, there's other physiotherapists, there's some naturopaths, massage therapists. So at that location, my initial assessment is only 40 minutes,
Okay.
and my subsequent visits are 20 minutes.
Mm-hmm.
And many people I do see subsequent visits for the 40 minutes.
Okay.
Now, in that length of time, it's generally enough for me. It is kind of tight from a treatment perspective. I don't always get to a treatment, especially if the patient likes to, talk, which
Mm-hmm.
they do. So sometimes there is a little bit of a constraint with that. But if it is, it bleeds over to the next visit. That's not a big issue. At the other location that I work at, I work in 30 and 60-minute sessions.
Okay.
So every new patient is an hour. That 20 minutes, gets me a little bit more comfortable, reduces any rushing for sure. I think an hour is enough time, even if they do, blabber on and on and on. And the half an hour subsequent visit, I also feel is a little bit more comfortable, because the same thing, if you're into 20 minutes, when people come in, you want to know about how they've responded to the last treatment. If that takes 5, God forbid, more than 5 minutes, then, you might be pushing what you can get done in a session. But at this point, I feel like that amount of time, I'm starting to work with it. I'm starting to adjust to it a little bit better.
Mm-hmm.
Whereas if you would ask me 2 years ago, I would have been pretty stressed out about it.
Mm.
But, I knew that I could condense it as I got more comfortable. And I think I'm to that point. So I know for some people, 20 and 40 minutes seems like a crazy short amount of time. But as you get efficient with this stuff, it's usually enough time.
Okay.
Even when they come in and you're writing your notes that you did, vastus lateralis to vastus medialis, and the next day you're like, okay, look at check the hip, check the external to internal rotators or whatever you write in your notes, and then they come back in and they're like, oh, my knee feels great. Can you do that to my shoulder? And you're like, you had like a set plan for that visit, and now you got to assess a whole new limb.
Mm-hmm.
When they tell you to do that, you got 15, 20 minutes, then hopefully it's pec minor to mid trap, and you can go from there.
Yeah. So that makes me really curious of what I was going to ask a second ago. How much NKT are you actually able to do? Like one or two tests? At what point do you stop the testing and say, okay, I've found out enough and I can move on from here? How much NKT do you start to really act
on? Man, interesting question, because again, it varies quite a bit. As far as my muscle testing, I muscle test, and how many muscle tests would I do? Like a lot.
Okay.
If somebody comes in, let's say a shoulder pain. If somebody comes in with shoulder pain, I'm probably going to test between 6 and 12 muscles on each shoulder, both shoulders. I always do bilateral, because you want to know if it's bilaterally weak. So where you're going if you want a therapy localize the spine. As a chiropractor, I have a bit of a bias there. And, it's not that I want to look for, usually you're not testing a few things and acting upon that. But sometimes if you're going in with an intention and you know exactly what you think you're going to find by the assessment or whatever, if you find it right away, you're going to correct it right away. So generally I like to get a feel for more than one, see, more than one that's weak in the clear. Because often if you treat one pattern, you'll improve a few others. But it varies quite a bit. So sometimes I'll go right in. If I see what I think I'm going to find, I'll treat it right away. Depends how much time's left in the session. Do I have 5 minutes? Do I have 10 minutes? Do I have 2 minutes? But generally I like to test at least a few muscles in the area. As far as homework and corrections, I may correct up to 3 or 4 patterns in a session. But homework, I often don't give more than one.
Okay.
I like to give one release, one activation, and then an integration exercise, whether that's based on a gait, based on like a strengthening exercise, a classic, bird dog, a squat, etc., right?
Mm-hmm.
So often I try and stick with that. But if they come in, they're an athlete, they're gung ho, I might give them 2.
Okay. Yeah. Well, Brock, I got a couple more questions for you. This has been really great so far. I'm curious just to hear what kind of great books or learning resources or things that websites, different things that you read and picked up and learned along the way that made you say, oh, now I have a clear understanding of how NKT works now that I studied, functional anatomy or motor control or different things? What are some good learning resources that maybe you could recommend to the students here?
Man, you know what the best learning resources are assisting the courses
Hmm.
and hearing how each instructor explains it. Uh, because you can look at some of these papers and you can see like a research paper of mid trap activation lowered in population with lateral epicondylitis, and you're like, oh hey, that's NKT. And if you read it, the way that's worded, it becomes very sticky, and I don't know if that really resonates because NKT is based on like motor control theory.
Hmm.
So when you're talking about something that's based on a theory, it's different analogies work a little bit better to really help a fundamental understanding of how those things are working. Um, so I don't know if, like I've read the summaries of the Vernon Brooks book that
Hmm.
David gives a lot of credit to. I haven't read it. It's like $1,000 on Amazon.
Yeah.
That's kind of but you read through those points and you're like, okay, that's cool, and that really resonated with David. It really helped him move along. But for me, a lot of the learning experiences I've had is like assisting Kathy Dooley, and the way she explains different things, because every time she explains it, there's a different way of wording it, and different students have different questions, and you're trying to almost explain NKT, which is, dare I say, the same thing in like half a dozen different ways.
Hmm.
So you almost learn something from yourself the way you break down a concept using an analogy with that person in front of you, which comes down to the value of assisting these courses. Because to explain NKT to each patient, like my explanation, unfortunately, I can't give you my constant explanation because it changes completely depending on the person in front of me,
Hmm.
depending on their education level, depending on their interest in it, right? If you go too sticky, too deep into it, they're going to tune out. Whereas, if you relate it to the hockey players, like here in Canada, right? Everybody likes hockey in Canada, most of us anyway. So if you talk about, a shoulder and, so a hockey team has a goal of, the goal is to score a goal. And if they have 5 men on the ice, but one gets a penalty, then now you have 4 men on the ice and they're trying to accomplish the same goal. But now each player their role has to change a little bit. They have to work together a little bit differently just to make up for that one player in the penalty box. So your shoulder is very similar. You have these muscles, and there's a couple that are offline. They're inefficient. They're in the penalty box. They've been strained. They're going under different stressors. So now everybody around the shoulder has to like work a little bit differently. So something like that really helps to resonate with people, right? To understand what NKT is, what we're trying to do,
Hmm.
versus the textbooks. I read so many textbooks, and it's just like I felt like that's all I did in chiropractic college, and it was all this black and white bullshit, which I probably don't give
Hmm.
them enough credit for, to be quite honest, because
Hmm.
they created that base for me to understand it and I excel as I have. But to think that one textbook really put it all together really helped. I think Stecco's fascial textbook, that was kind of cool because to see the cadaver, like a few cadaver textbooks have been really helpful because that's what the anatomy actually is, right?
Right.
And I remember anatomy trains, when I read that, I was like, man, I can't wait to have this book make clinical sense.
Hmm.
Because being a chiropractor and it being written by Thomas Myers, like more of a rolfer, like our professions are so different. How is this going to be useful and effective in my practice? So in NKT level 1, when I saw that slideshow and I saw the anatomy trains, I was jacked. I'm like, hey, this makes sense. This is why people have their SCM neck pain when they're doing a sit-up,
Hmm.
because of that picture right there. And now I have a way of testing to, confirm your hypothesis.
Hmm.
So any level 1 student, prior to them taking the course, I want them to know their functional anatomy, and I recommend anatomy trains
Hmm.
because I think putting NKT into practice is a little bit more effective than sitting and harping on the actual neurological basis of how it's working. Uh, you're improving proprioception, and you're getting the body stuck out of a bad motor pattern and showing it a more efficient way, which I believe it's often once it's exposed to that, there's a higher likelihood of it repeating it, as long as you remove the triggers from their environment, because that's what we're kind of hardwired to do, right? So yeah, does that answer the question?
No, that's great. Yeah, I totally agree with you. As soon as I started assisting, it made me realize, oh my gosh, I don't know this concept at all, and then rack my brain to figure it out. And then when I had to explain it, there'd be all kinds of things that would come out of me that's like, oh, I never thought of it that way. But suddenly, like on the spot here, talking about it, and I had to teach it to people, I just totally realized it in a whole new way. And I completely agree. I think that when you start assisting, it really makes you learn it really well, and you get to experience other people's teaching, or how a certain instructor might teach it differently over the years, and you can see how things might change or morph. I think that's an excellent way of learning, definitely.
Yeah, like any therapy is, if you've had a therapeutic benefit, regardless of what you do, NKT or otherwise, if you've had a therapeutic benefit, I believe that in a way you have improved proprioception. Whether you did that from a very MSK approach, whether you did it from toning down their nervous system from an emotional or psychological state that they're in, you made them better able to find their own body. You've improved that connection with their own body, which is improving proprioception. The value of a therapy localization. I have people therapy localize stuff all the time, moving their arm. Hey, if you touch here, does that like feel better when you move your arm? And they're like, oh yeah, a little bit. Why is that? And it's like, because you're improving awareness from that joint. So whenever I test people out for NKT, I have them explain what a therapy localization is. Like, I'm just looking for that, improving that proprioceptive value to the areas, so the brain can make a better decision on motor control. And then eventually, when you test them against each other, acting on that in decision, and making it a little bit more, understandable by the brain.
Yeah. Well, Brock, do you have any just last words of advice, or even just a last good story to share, or, like a motto or a saying you keep in your head that just helps you with your practice, or any kind of last words to share with the students here?
I would say, like, one thing when I teach is you cannot unlearn what you've been exposed to. And once a mind expands to a certain capacity, it cannot retract. And if you do, you're only kind of lying yourself, you're fooling yourself. My hope is, like, with at least the NKT courses, that people see the value to muscle testing through the instructor, through the assistants. And then that value, it sticks with them, and in a way, it haunts them. And it haunts them until they become comfortable with it. Because when you leave the course, it's very easy to say, like, that was really cool, but how am I going to own that material? Because anything worth learning is not easy, it's not simple, but as long as you see the value there and you make that commitment, the longer you stick with it, like, the easier it gets. Like, it only gets easier. And if you want to take that break, as I said, the breaks are what really kind of jumped me to the next level, because something sat in, something connected, something resonated. Hard to say, there's probably textbooks on memorization and memory, right? But taking a break and letting things sit in, and then when you go back to it, everything makes more sense. Everything's a little bit easier. Maybe your words make a little bit more sense. Maybe they jive together. Maybe your touch, you're like, oh, I'm getting this touch down now. So I think, there's nothing wrong with taking a break from NKT and taking a break from testing when you're frustrated. It's actually, like, what I recommend. But the idea is that you don't ever quit. You don't ever stop, because muscle testing, there's a lot of things involved in muscle testing. We're trying to make it black and white, binary and strong and weak. But, when we're looking at the hierarchy of motor control, the limbic system trumps all. And whether it's your limbic system, whether it's their limbic system, people don't always come in completely testable. So if you're thinking everybody's going to come in and everybody's going to be easy to test, you're starting with unreasonable expectations. And there are ways, as you progress through NKT, to help improve the testability and help to recognize when people are more testable or less testable in a given scenario. Because sometimes they come in so jacked up from something with work or family, that their muscle testing is bogus that day. So that doesn't mean you have to muscle test them that day. You don't have to use NKT every day on every single person on every visit. That's not the point. The point of NKT is to help, get you out of those, like when you're confused, to get you off of the plateau, to help understand what's going on. But every person, every situation is not going to give you valuable information through your muscle testing. And if you expect that, I can see how you get very easily to be frustrated and say, this isn't worth it, because this isn't consistent. And muscle testing is extremely consistent. When you realize that it's inconsistent,
Yeah, yeah.
Made sense in my head. Hopefully it makes sense in your head.
No, I get it, yeah.
Whoever's watching it.
Yeah.
So you can't throw the baby out with the bathwater. I remember Thomas Wells said that to me when I was fortunate enough I had dinner with him, and he said people throw the baby out with the bathwater with muscle testing, and they don't realize that it isn't consistent. But there are ways to understand when it's inconsistent. And the more you do, the more you learn about it, and you understand those specific times. It becomes that much easier, because then you're like, okay, right now there is no valuable information to gain from this person in this moment. So I'm going to do something to help their nervous system get back to a level that's going to still improve their symptoms, or that's going to improve their day. Because maybe that's your role at the time as a therapist, or if you're a trainer, maybe we're going to go through a light workout, get the blood flowing, get the endorphins going. We're not going to stress the nervous system in this moment of time. So the more you can pick those situations up as a clinician trainer, whatever you are, which, a lot of it is experience, a lot of it is sticking with the NKT. So you pick up those patterns, right? It's pattern recognition. So once you realize that muscle testing is inconsistent, you realize how bloody consistent it is. And then that's when you can't go back. Because if somebody takes away muscle testing from me, it's like they're tying my hands behind my back and asking, to palpate. It's like, how can you gauge any information really without muscle testing? Like at that point, it's just guessing, right?
Yeah. Yeah.
Why you test, don't guess. Have you heard that before?
No, I've never heard that before. I don't know where that came from. Yeah. Well, Brock, this has been really great. I appreciate you just being here and wanting to share. And you got some great stories and great wisdom. I'm really honored just to be able to talk to you. Thanks so much for being here today.
I appreciate that, Brandon. Man, I'm happy to help out. I think what you're doing here is excellent, because there's a lot of people who take NKT and they get stuck and they get frustrated. And from hearing myself and all the other people you've interviewed, hopefully that helps them stick with it.